It's an honor for me to present my innovation together with Dr. Kenneth Egol and Professor Vaida Glatt at the Academy meeting.
As far as disclosure, I want you all to know that I am not an investor in this company. I do not receive any royalties. Ilya hasn't even ever bought me a cup of coffee. You know, I've been doing this for over 30 years, and I prescribe people weight-bearing restrictions. And they ask me, you know, how do you do that? And I often tell them, I don't know. Usually what we do is say, well, go step on a bathroom scale, and you can kind of figure out how much 30 pounds is or 40 pounds is, and you know, remember that feeling, and see how you do. And I was happy to get my patients involved. We did an IRB-approved prospective trial, and we gave all of the patients. We did this. It's a pilot study. We did it with 20 patients. And they all had lower extremity fractures, pilons, ankles, plateaus, distal femurs. And they were randomized to either receiving real-time feedback or not. In other words, the device would give them the feedback as to how they were doing on their weight bearing. And what we did was we had people come in the office, and we installed the crutch tips for them to make it easier. We got them on the app. And then we had them all step on a scale in the office to show them what the prescribed weight bearing was. So for a person who had 30 pounds, we'd show them what partial 30 pounds felt like. And we said, you know, try to remember that and go with that. And then we kept the data on all of the patients. And basically what we found anyway, was that patients receiving the real-time feedback had a 3 times greater adherence to the weight-bearing protocol that we prescribed, which makes sense, right? Because it's a learning type thing, and when people get feedback for anything, they can do a better job of improving their performance. I was actually very surprised in New York City, kind of a tech-heavy city. People were even my older patients were very, very interested in the technology of this. They thought it was really cool, and they felt that, you know, they were taking part in their own care by doing this, which I thought was pretty interesting. We had excellent usability scores. They felt that it was very easy to use, high patient satisfaction rating, 9.6 out of 10. And there were no safety issues with the use of the device.
It takes some time to figure it out, to almost understand it mentally, what you have to do and how you have to walk. But the device itself makes it so much easier, because otherwise I honestly don't think you'd even know at all how much you're supposed to actually apply.
If you are on crutches and your recommended recovery involves some percentage weight bearing, I think there is no other way to understand that than to have these tips.
Yeah, so, you know, we prescribe these weight bearing precautions for a number of reasons. Number one, we want to protect the patient, right? If we're fixing a periarticular fracture with hardware, we want to make sure there's enough healing before we allow for full weight bearing, so that we don't overload the construct and have an early failure. But we want to load the bone, and we want the joint to be active, right? We want the bone to see load to enhance healing, and we want the joint to be active to enhance cartilage nutrition and restore mobility. Now, what are these findings mean clinically? Well, first, this biofeedback that we were able to give the patients really allowed us to give patients a tangible target that they could hang their hat on, right? And we know that, secondly, adherence improved. We know the surgeons are going to feel more comfortable about advancing people. You know, if we know that the patient is following our prescription, you know, after 4 weeks, we see that they're very compliant, we can advance them very slowly and we can follow them. You're able to monitor the patient with this as well. And the third objective was, as I mentioned, the balance between healing and hardware protection, right? We all know that there's a race between bone healing and hardware failure. And I think this helps us, you know, once we're done operating on the patient, we have x-rays every 6 weeks or so. That's the only way we know what's going on. But I think this gives us another valuable insight into how the patient recovery is going. So, again, these are the things I mentioned: precise adherence, prescribing accelerated bone healing, and risk reduction in hardware failure. You know, in conclusion, I feel that these crutch tips are not only effective, but they're safe, they're usable, and I think they can help us in our clinical practice with patients to have a very standardized approach to the way we prescribe weight bearing after fracture surgery in the lower extremity. So